Nurse staffing and patient mortality. My name is Cassandra Pizarro, and this is Amanda Berg, Lindsay Rowland, and Kimmy Stevens, and we're all student nurses from Cedar Crest College. Research shows that there is a correlation between decreased nurse staffing and increased patient mortality. This problem is significant because it suggests that there is, in fact, a breakdown in patient care. Also, the liability and psychological stress to nurses and healthcare team from understaffing can decrease the quality of the work environment and also lead to job burnout as well. These are all important factors that can help improve evidence-based practice and also patient outcomes.
In the literature search, databases utilized were Google Scholar, EBSCOhost, and CINAHL. Keywords that were used were nurse-patient ratio and mortality, nurse staffing and mortality, nurse staffing and patient mortality. Our limitations included articles dated from 2007 and newer.
In the research by Aiken and colleagues in 2011, patient outcomes were compared to nurse staffing, nurse education, and work environment. Evidence suggests that patient death can in fact be lowered by 9 to 10% when combined with a good work environment and also increased staffing. This study used 665 hospitals across the states of Pennsylvania, New Jersey, Florida, and California. There were over 1 million patients included and a large random sample of nurses.
In the article written by Schilling and colleagues, patient mortality increased with levels decreased by staffing. There was an increase of patient mortality by 0.35% for every decrease in one full-time equivalent registered nurse. For every full-time equivalent registered nurse added, mortality decreased by 0.16%. This study is a retrospective pilot study which was conducted in 39 Michigan hospitals. There were 13,343 patients admitted with the primary diagnosis of a hip fracture.
In the study by Cho, Huang, and Kim in 2008, the relationship between nurse staffing and patient mortality in the intensive care unit was examined. The results showed a 9% increase on mortality for the care of each additional patient, resulting in 15 excess deaths per 1,000 patients. A mixed ICU showed an even greater increase in mortality. This study was a quantitative descriptive correlational design taking place in ICUs across South Korea. 27,372 patients from over 236 hospitals were used, 42 of which were tertiary hospitals, and the remaining 194 were secondary hospitals.
In the research by Needleman and colleagues, the association between RN staffing and patient mortality was analyzed. The results indicate that there is a correlation between increased mortality and increased exposure to unit shifts when RN staffing is 8 hours or more below the target level. The results also concluded that step-down and general care units had an increased level of staffing in the daytime compared to the evening. The setting these results took place in was a large tertiary medical center, and it included over 190,000 patients.
Recommendations are to increase staffing, which should be the highest priority to decrease mortality, improve work environment, hire more bachelor degree registered nurses, and ensure that workload is distributed equally to ensure that one nurse does not have more than the other in order to divide up patient care. An implementation plan could include an increased proportion of bachelor degree nurses from 50 to 80%, striving to become a member of the Magnet Recognition Program, offering financial incentives for increase in staff levels, and also to improve communication between nurses.
These studies overall are a blueprint to help implement change. It is important to identify where change is needed. The use of evidence-based practice is crucial to keep the hospital current and to decrease overall patient mortality.
Thank
Thank
you.
you.